This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2022. When patients suffering from severely debilitating end-stage ankle arthritis do not respond to conservative treatment, physicians recommend total ankle replacement or ankle arthrodesis. However, there is a paucity of information on how sex differences influence functional outcomes before and after surgery. To this end, researchers from Canada identified patients who had undergone total ankle replacement or ankle arthrodesis with at least 2 years of follow-up from the Canadian Orthopedic Foot and Ankle Society Prospective Ankle Reconstruction Database. A total of 316 men and 313 women had opted for total ankle replacement, whereas 154 men and 89 women had undergone ankle arthrodesis. Preoperatively, women had worse ankle osteoarthritis scale (AOS) pain scores, greater disability, and worse physical function than men across both surgical groups. The researchers attributed these findings to women's apparent willingness to live with more disability, a greater likelihood of women living alone, their concerns about social support and of being a burden, a lack of trust in medical care, as well as the unconscious gender bias of physicians. Interestingly, despite women having more pain and disability than men preoperatively, their pain improved more than that of men post-surgery, and their improvements in disability and physical function following surgery were equivalent to those of men. However, the differences observed between men and women were relatively small, and they largely disappeared when confounding factors like preoperative pain and disability and function scores were taken into account. Similar gender differences in pain and disability and function have been observed before and after hip and knee arthroplasties. Overall, this study affirms that both total ankle replacement and ankle arthrodesis are good surgical options for men and women with end-stage ankle arthritis.